Hello everyone, welcome to Community Connection, your window to the world around you. Health consciousness is on everyone's mind, and it's very vital to talk about healthy resources and healthy communities. And today we're here with Betty Priscorn, who is the Vice President of Community Health and Outreach through Beaumont, talking about a Healthy Communities Initiative. Betty, welcome to Community Connection. It's wonderful to have you here.
Thank you for having me.
Tell us about this Healthy Communities Initiative. It sounds amazing, it sounds wonderful, and reading a little bit about this initiative, I was a little bit educated in the fact that Wayne County is one of the most unhealthiest place to live. So this conversation is really, really important. So we're 82 out of 82. So tell us about this healthcare initiative and how we're moving forward to create resources for healthier communities.
I'd be happy to. In 2013, Beaumont Health undertook a community health needs assessment. This is a requirement under the Affordable Care Act for all nonprofit hospitals. So nonprofit hospitals are required to do a community health needs assessment, to identify the top health priorities in the community, and then to develop a plan on how they are going to improve health. So this was quite an undertaking for all of our hospitals, and based on that assessment, there were 4 priority health needs that were identified, and those were obesity, cardiovascular disease, diabetes, and access to care. So at that time, this was under the Oakwood healthcare system. We developed a strategy called Healthy Communities to really wrap our arms around the communities that we serve, pull together all of our nonprofit partners, but most importantly, involve people in the community in their own health and devising plans on how they and their families can become more healthy.
And you have a pilot city right now that you're working in.
We actually have 4 pilot cities: the city of Dearborn, the city of Trenton, the city of Wayne, and the city of Taylor.
And how were those cities targeted in terms of this initiative?
Well, it was interesting. We started off, we were going to have 1 pilot healthy community, and word got out, and actually the mayor of Trenton was one of the mayors that approached us and said, I want to be a part of this. To be a healthy community, the mayor and city council and the school superintendent and school board all agree to consider health in all decisions. So there's a MOU with the hospital that we're going to work together and engage the community on improving health. So these were very proactive mayors. The mayor of Dearborn, Mayor O'Reilly, has just been so absolutely incredible and supportive. He attends our Healthy Communities meetings, but it's so wonderful. We know we can't make an impact on health unless we all work together. So we have 4 pilot healthy communities, and we're not just targeting those communities. Those are the communities that we might we put resources in, but all the surrounding communities are invited. We just thought our chances as a region to improve health, let's try it 1 community at a time and see what we can do and spread our efforts out across all of our communities that we serve.
Speaking of Dearborn, there's a new superintendent, of course,
yes.
Superintendent Glenn Maleko, and I know that he's very passionate about this. And really healthy lifestyles, healthy living starts at a very early age. So when you're talking about the schools, I mean, that's a perfect place to target healthy initiatives. So, I mean, when you look at the menu for lunch, you know, during lunchtime, you have chili dogs, you have, you know, different things on the menu that aren't the greatest and aren't the healthiest. And I know there was a movement and initiative to actually focus on that. So is Healthy Communities, this initiative, focusing on changing those menus and creating educational aspects within the school to be able to teach children about, you know, healthy living? Betty, you know, in these times, you know, mothers are out working, you know, you have a 2-income family, and it's really difficult to put healthy things on the table. So, you know, through that kind of education, you know, sort of starting at that level and building up makes a lot of sense. What kind of approach is this initiative working on to address those things?
That's a great question. One of the things that we're very excited about is our Healthy Communities has different action teams in each community. So Healthy Schools is one of the action teams in Dearborn. The school has been a wonderful partner with us. We look at the school menus. We look to see how we can support the schools. But one of the wonderful things too about being a healthy community is we look at from early childhood to older adults, what small steps can people make to improve their health. So healthy eating, active living is our mantra. And we work a lot with the Head Start programs. We do after school programs. We support, it's called Catch Kids Club in the city of Dearborn. So we have after school programs that we do. We do free nutrition classes. We do grocery store tours. So we, the people in the community are invited to come to grocery store tours. We teach them how to read labels. They get a $10 gift certificate to buy healthy foods in the store. We do free cooking classes. We do diabetes education and support programs in the community. And these are all at no cost to residents. And they've been very successful.
That's amazing. What kind of participation have you seen within these different areas?
One of the things that I'm so excited about is that we have been booked to capacity on all of our classes, and that tells me that we're doing the right thing and that people truly are invested in their health. You had mentioned moms. If you've got a mom who has, several children, is working full time, we need to make it as easy as possible for people to have a healthy lifestyle. So when we do our classes, we teach them how to budget. Can you eat on a budget? How can you prepare healthy meals for your children? How can you prepare healthy snacks for your children? And we recognize that families are the experts too. So we look to have the community engaged and tell us what programs and services do they want. And I think by community residents having a voice in what they feel that they need in the community, that leads to the success of our programs also.
Oh, absolutely. Obesity is a major, major issue. And again, that's tied in to not eating right. But once you do start to eat right, you still have, that issue, and that needs to be addressed through exercise and through, the physical aspect. So how is Healthy Communities addressing that? I mean, going to the gym, of course, but again, you're talking about an economic issue as well. So what is being provided in regards to that, and what's your participation?
Well,
because I want to come.
The great thing is, particularly in the city of Dearborn, there is such a wealth of resources and green space too. This part of our effort involves community development, and we've been working with the city on looking at walking paths, looking at things that families can do for free. The mayor was very engaged and wanted to have a family bike ride in the fall, and it was a freezing cold day, and it was very successful, and we're building on that this year. But the activities that we're looking at.
And I didn't come because it was cold.
Well, we're going to have another one this year.
Sounds good.
The mayor is very passionate about incorporating more healthy activities and programs into the homecoming festival that they have every year.
Good.
So, we're looking for more ideas on what we can do. We're looking at bike stations being located around the community where residents of the community can check out bikes at one place and have access to transportation, but how do people get more active in their own daily lives? So there's a lot of planning going on right now. I think there will be a lot more exciting activities, but as I said, we went from early childhood to older adults. People recognizing just small steps and increases in activity can improve their health.
So your focus just isn't children or adults. It's a family-oriented
Absolutely,
kind of thing.
Yes, absolutely. We don't want people to get frustrated. We want them to recognize they can be successful just with small changes in their lives.
The concept of Wayne County being the unhealthiest county in the area, just it's hard for me to wrap my arms around that. But how did we attain, at least we're on the books, right? How did we attain this status? What did you find within working in this capacity were the biggest loopholes that we have to address to get out of number 82?
Well, there's so many things that impact health besides healthcare. Do you have healthy foods in your neighborhood? Do you have transportation? Do you live in an environment that isn't heavily polluted? Infant mortality is a huge need in the Detroit area and in some of our surrounding areas. 3 years ago, when we did the community health needs assessment, the Affordable Care Act was just rolling out, and many people didn't have insurance. This year, when we're doing the community health needs assessment, we're finding out that while many people have health insurance, the deductibles and co-pays and co-insurance are impacting their ability to access care. So we're always looking at, what is impacting health. There could be, safety is a health issue in a community. Do you live in a safe neighborhood that you can walk and your children can go out and play? So there's so many factors that impact health. We try to look at the whole big picture and what we can do to support health in the community.
So is the Affordable Health Care Act actually a tool to create more access to health care, or do you find that it's a hindrance as well because of the increased co-pays that everyone has been experiencing? Because there's a fine line there in terms of being helpful and in terms of cutting people out who used to be able to get health care.
I think it's been wonderful because so many people that did not have insurance before, with the tax credits, with the Healthy Michigan, which I think was a wonderful plan that our state adopted, many more people have access to health care. We're seeing some different problems right now. With our immigrant population, some of them don't qualify for health care, so we've seen funding go down for some of our free clinics. So Beaumont Health is supporting our federally qualified health centers, our free clinics. We want everyone to be able to access health care.
And you said the magic word, Access, which is a social services agency in Dearborn.
Wonderful partner of ours. Yes, we work very closely with Access. We view them as one of the valuable partners. This isn't just an Oakwood initiative in the community. We have over 75 different nonprofits that are involved with us in improving health in the community. Not only Access, but Henry Ford Healthcare System, many of the other healthcare systems we're all working together. We all need to continue to work together to improve health.
Absolutely. I mean, that is really vital. In terms of funding, you touched a little bit, but given the environment and given the state of our country in regards to funding different initiatives that are really vital, where is the funding actually coming from for these initiatives?
One of the things.
Loaded question?
No, it's a great question. It really is a great question because one of the great things about us working together, I might think differently on this, but I think there's more than enough money to do what we need to do if we are collaborating and not duplicating the programs that we're doing. We're maximizing the resources that we have. So if I know another healthcare organization is going to be doing something in the community, that's wonderful. And we work together, I'll do something else so we can really impact health. We've also been fortunate with the community partners that we've all brought together. Many of them already have funding. For example, the National Kidney Foundation is a wonderful partner of ours. They do our diabetes program in the community for us. Wonderful. Gleaners is a wonderful partner for us. Access is a wonderful community partner. So we all bring the programs, resources, funding that we have to the table. And it was interesting because we are not only competitors in some areas, but we're also wonderful collaborators as we work together.
And I believe strongly in that. Why reinvent the wheel?
Absolutely.
You can bring everyone together. What is the main focus right now? Summer's coming. And, of course, there's different initiatives in the summer. People are outside a little bit more. And you talked about having, bicycle areas within the city. And that would be phenomenal. Of course, that costs money, but, that would be phenomenal. So what is the focus right now, given the better weather, hopefully the better weather coming very soon? What are the projects you're working on?
Well, you will be seeing new walking clubs being initiated throughout the community. We're also looking at how do we maximize the trails that are already there? How do we create some innovative ways for people to get engaged and have fun. We don't want this to be
fun.
viewed that, oh my gosh, this
Sure.
is something that I, have to do. But it's what can we do to make it fun for children, make it fun for older adults to engage in physical activity. So this is why the community voice is so important. We don't want to come into a community saying this is what you need to do. It's the community telling us what they would like to see and have. The community has a wonderful plan that they already have in place, wonderful resources in the community already. How do we take those resources and put in activities that children will engage in, that older adults will engage in? We're looking at not only physical health but mental health. What are peaceful, serene surroundings that people can enjoy, whether they're doing Tai Chi in a community park, whether they're doing a bike ride. We're talking about doing some type of glow roll with the bikes in the evening this year. So there's many things underway right now, but we still would like to have community engagement, more community ideas on what the community would like to see.
And you mentioned you're working in 4 different communities right now?
Yes.
Trenton,
Taylor, Dearborn, and Wayne.
Okay, so we're in Dearborn Heights.
Yes, but
Talk to me.
Dearborn Heights is a part of Healthy Dearborn. It's the surrounding area. So the communities that are connected to that, anyone in Dearborn Heights are welcome to the activities that we do. And we're hoping as we spread out throughout these communities that it will be a seamless region of care, that it's not segregated by community, but it's an entire region that's improving their health.
Absolutely, absolutely. You also said that it's important to collaborate in regards to, city council, in regards to the mayor, and I know Mayor O'Reilly is phenomenal, and our Mayor Paletko as well, would definitely be on board in regards to doing something like this. But what is the reality of that vision being created in these different cities? I mean, the one thing that really struck in my mind in regards to what you said was having the bicycle areas there, and having people being able to have some kind of transportation. But what is the realistic vision of creating all those wonderful things within all those different cities?
Well, we mentioned the healthy communities, the individual pilot projects, but what we didn't mention is overseeing this, we have a leadership coalition of consisting of the state of Michigan, many of the hospitals, many of the superintendents. So there's 100 and some odd people that are involved in it. We developed a strategic plan for our region to move health forward. So we are pulling together all of our partners, their tactics of what they're going to do to improve health in our region. So it's more sustainable. We have so many people that are engaged in this initiative now. We kind of have the spotlight shining on us because
it's important.
It is important, but it's I think we were a bit surprised of the number of people that continue to come to the meetings. We have elected officials. We have many people from across the Tri-County area that are a part of this. And I think the commitment, the passion, the realization that unless we all work together and have that collective impact on health. And I think we have people coming that want to spread this out throughout the state. So we've had incredible support. I think there's realization that if we all work together better, that funding will follow this. We were very excited that we just had a submission to the Robert Wood Johnson Foundation. We were asked to submit a full proposal for the city of Dearborn. So we think that money will actually follow these initiatives too.
Okay. Your main focus is preventative.
Yes.
Not so much providing health care when someone is ill, correct?
Well, we're hoping that with our efforts, it will decrease healthcare costs, that people will have better access to care. So it all ties in with each other. We think it will save dollars in the long run if we're catching people early enough before chronic disease starts occurring, that it will benefit the hospitals, it will benefit the communities, it will benefit the people themselves in the communities.
And we talk about healthcare in general, but when you also talk about healthcare, you have the mental health part and the physical health part. And given everything that's happening in our world, the crazy world that we live in, and also, you know, we have an influx of immigrants coming in from war-torn countries who have been, you know, devastated, terrorized, basically. So that's another whole area in regards to, you know, healthcare and prevention. Is there also a mental health care component to all of this as well?
That's a great question too. It's interesting. We just completed last week the focus groups in the communities across 3 counties. We really take into account community input on our health needs assessment. Every single community focus group that we did in 3 counties, mental health was a huge concern. To be honest with you, we have not had a great system here for mental health care for children or for adults, and we need to improve it. We recognize the importance of the integrated health care, physical health and mental health. We do that in many of the programs and services we do. We need to get better at that. There needs to be a better collaboration between physical health care and mental health care. Access does a wonderful job on that. We also have 7 teen health centers located in high schools and in the community, and they do a wonderful job of integrated health care. So I think as more time goes on, you will be seeing more of that happen. But as you know, funding for mental health is not where it needs to be right now. So
absolutely.
We need to do a better job with finding ways to fund mental health also.
Absolutely. And I find that, especially within the teenage years, I think it has increased and escalated in regards to, you know, the frame of mind, especially of our young men. It's been really difficult to find those mentors and to, you know, find individuals to, you know, take young men on who are a little bit, you know, not where they need to be and need a little bit of focus. And you know, with the economic decline that we experienced, you know, for the last few years, you know, the job market has been really decreased as well, and so you have a lot of kids who are not made for college, who cannot, you know, go in and say get a factory job and make a decent living. And so I think that as well contributes to the mental health issue as well. So you know, with this particular initiative, I mean, you can focus on you know, certain issues and preventative methods and what have you, but when you look at the bigger picture, you know, there's so many different components, because when you're not mentally healthy, you don't want to eat right. And when you're not feeling, you know, that you're going where you need to be, you don't feel like going out and exercising. And so, you know, those kinds of things are important.
And that's why our education system is so important in tying that in with health too. That is
your
key.
Partnership with the schools.
At early childhood education, I mentioned the focus groups. We also heard that stress is a #1 issue from early childhood to older adults.
Absolutely.
And how do we relieve stress? So, you know, we're doing mindfulness in schools. We want to get, from an early age, more support for not only children, but also for the education, the teachers, the entire system. So it's finding ways that we can mentor our youth, that we can support them. As you had said, with employment training, with education, it all comes into play.
Is there any initiative with employment training at all? I mean, that's sort of on the opposite end, but
you know, that is a part of our healthy communities, and we have many of the school systems that have specific programs, or many of our community partners do employment training. So they have a voice at the table. They will play an active role. While Beaumont is called the backbone organization of these communities, we also have all the different sectors that are there, and so they will be providing. We can't be everything to everyone, but we know that we need to have these people at the table providing those programs and services that they specialize in too.
There's a lot of health clubs in and around the area. Hype is one of them.
They're a fantastic organization and a huge partner. We appreciate their efforts and involvement so much in the work that we're doing, not only in the healthy Dearborn area, but also in the city of Wayne. Their director has been just incredibly supportive and so committed to the community. So yes, we just value his partnership. He's a great person and really walks the walk with supporting the community. So
if people wanted to get involved, they wanted to be either part of this healthy initiative or volunteer, what would they have to do?
Well, you can share my contact information. Sarah Gleischer is the project manager for the city of Dearborn and would love to have more community involvement. We have 5 community groups that people can be as active as they want to be, but we want to hear their voice, even if they want to send us an email about what activities they would like to see. We're looking for those innovative programs that might attract teenagers, that we're looking for youth involvement. What would youth like to see in the community? So we want to engage everyone. So they're welcome to contact me or Sarah for more information.
Wonderful. And we'll put that information up on the board. Well, this is amazing and so needed. And so, and I hope that people realize that getting involved in something like this will create not only healthy, communities within their community, but within families. So we start one family at a time with education. And I have to be honest, we don't eat the best in my home either, because we're always busy, always coming in and out, and I'll come home and I'll go, oh no, I didn't make dinner. And so you think about those things, and you don't want to just order out every night. So education is really important, and with all the preservatives that have been added to our foods, I think that has really increase the amount of sickness and the amount of ADD. I really believe that has something to do with our environment and what we intake into our bodies.
Well, we view food as medicine.
Yes.
So we're also working. We're also working with many of the restaurants in Dearborn and the markets. We also are very involved with the farmers market here in Dearborn. So, what are innovative, creative ways, and how can we make it as easy as possible for people to be healthy and prepare meals?
And prepare easy meals.
Yes,
really
absolutely,
quick.
absolutely.
We're going to keep you to that. Well, thank you so much.
Thank
Betty,
you so
for
much.
Being here. So much wonderful information.
Thank you.
I know our viewers, will take this to heart. Eat healthy, exercise well, and go see your doctor when you need to. Thank you so much for joining us on Community Connection. We'll see you next time.